Welcome back. It's time to check in with our friends from MUSC Columbia. Today's topic is lung cancer awareness. According to the CDC, more people in the U.S. die from lung cancer than from any other type of cancer. So joining us now with information that you should know is Chasity McCray, a nurse practitioner with MUSC Columbia. Thanks so much for being here.
Thank you for having me.
So tell us about the main types of lung cancer.
So there are two main types of lung cancer, small cell lung cancer and non-small cell lung cancer. Non-small cell accounts for 85% of cancers or lung cancers. It can be further divided into adenocarcinoma, squamous cell carcinoma, and large cell carcinoma.
Now, between those two main types, are there any key differences?
Small cell carcinoma is a little bit more aggressive than non-small cell.
So why is early detection so important?
Early detection is important because in high-risk populations, if we can catch lung cancer early, the cure rate is a lot higher. So we like to target the high-risk population. If you notice that you kind of fit into the screening guidelines, we encourage you to reach out to your primary care provider or either to our screening program to inquire more about the low-dose screening CT scan.
Yeah, what exactly is that, the low-dose CT scan?
So the low-dose screening CT scan is a screening CT scan that we target the population of patients who are ages 50 to 77 who are currently smoking or have quit smoking in the past 15 years and have a 20-pack year smoking history. A 20-pack year smoking history just means that you've either smoked a pack a day for the past 20 years or 2 packs a day for the past 10 years. That's just kind of a frame of reference there.
Now, I would assume that smokers or former smokers are probably the high-risk population that we're talking about here. Any genetic component to these cancers?
So that's not very common, but there are some instances where genetics can play a role. Genetic mutations and familial predispositions can play a small role in lung cancer.
Now, what are some of the symptoms that might tell somebody I need to get checked out?
So with the screening portion of this, we do try to target patients who don't have symptoms of lung cancer, things to kind of clue you into maybe you need to speak with your primary care provider about getting tested for lung cancer, though, would be just kind of like cough, shortness of breath, maybe pneumonia or bronchitis that you can't really get rid of. If you're having any of those symptoms, I would recommend following up with your primary care provider.
Is lung cancer treated differently than other types of cancers when we're talking about treatment?
For cancer, it is kind of specific to the type of cancer that you have. Overall, the main types of treatment would include surgery, radiation, chemotherapy, immunotherapy. Those are the things that you kind of hear about when you're talking about treating cancers.
Is it possible that non-smokers develop lung cancer as well?
Yes, it's not very common. Again, smoking is the #1 cause of lung cancer, but you do have exposures such as radon, very, very high levels of air pollution, asbestos, and even chest radiation sometimes can cause lung cancers.
Any connection between secondhand smoke and lung cancer as well?
There could be, yes, a small connection to that as well.
Now tell us about smoking cessation and why that's important.
Yeah, so with smoking being the #1 cause of lung cancer, it is important to, if you smoke, stop smoking. Smoking cessation is the term that we use for quitting smoking, and there's many different ways to quit smoking, with it being nicotine replacement or either prescription therapies, sometimes even just group therapies and that type of thing. So that's another thing that in our screening program we can assist with smoking cessation. And then of course your primary care provider, there's different helplines out there as well. So we do encourage smoking cessation for sure.
Wonderful. Thank you so much for being here.
Thank you for having me.
We'll be right back here on Soda City Living.